So clinical academics are a really important part of the NHS workforce and HEI workforces, and there are a very large concentration of them in London. So I think it's important for us to look and interrogate and see if there are ways in which we can improve the training experience for those individuals.
So I think it's very important because in addition to excellent clinical competency, it develops people's skills in research, and it develops their academic skills, and it thereby hopefully makes them the future leaders of our research programs.
I think there's lots of things that's been really enjoyable about being a clinical academic. I think firstly having the time and space away from clinical medicine with all the pressures of on-calls and the strains that clinical medicine can bring. I think having academic research blocks is really lovely to have that time and space to gain a bit of expertise in your specific research area, to go to conferences and to gain skills. It's a real privilege to have that protected time and funding.
In dentistry, I think sometimes we think that there's not a lot of funding out there for us. It was nice today for someone to say, no, actually people have managed to get dental funding when they've applied.
There are some challenges with being a clinical academic. I think certainly gaining grants and gaining fellowship to funding is always tricky. I think that's true across all of academia, not just for clinical academics. But it is certainly challenging getting used to rejection, which perhaps we're not used to in our usual clinical jobs. But with lots of support from your institutions and mentors, it certainly we obviously can be successful in gaining grants and fellowships.
London has a huge choice of academic institutions, great expertise in almost every specialty, and many support networks. So I think actually London is the sensible choice if you want a great career in academia, because everything is at your fingertips.
What I learned today was that there can be lots of very small problems which can make clinical academic training pathways troublesome. And I think that if we work together with the London higher education institutions and Health Education England, we can solve some of those collectively.